Hello and welcome. My name is Chris Rowena, and I'm the lead communications analyst at HCAI Health Workforce Development. We're thrilled to have you join us today for the Rural Health Transformation Program webinar. A little housekeeping before we begin. This webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the chat and the view controls in the menu bar at the top of your screens. The chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. We will try to answer as many questions as possible, but may need to defer questions specific to individual situations or to the CMS notification of funding opportunities. This webinar is being recorded and will be available within 5 business days on our website. Let's talk about webinar objectives. We're here today to inform and clarify the role of HCAI and the State Office of Rural Health in the Rural Health Transformation Program planning, to review the current rural health landscape, to inform participants on the purpose and the goals of RHTP, to inform participants on the RHTP stakeholder engagement and how HCAI intends to gather feedback and input. And with that, it is my pleasure to introduce the Director of HCAI, Elizabeth Landsberg, who will get us started.
Thank you very much, Chris, and I just really want to appreciate everyone who is participating in the webinar. We have over 250 folks on thus far, and we appreciate in advance the very valuable input you're going to give us as we at HCAI develop California's proposal for the Rural Health Transformation Program. So my 2 main messages just to start things off are your ideas are important to us, and we really encourage you to think outside the box. So in terms of the first piece, your ideas and input are just going to be critical as we develop California's proposal for this Rural Health Transformation Program. Stakeholder engagement is critical, so we look forward to hearing from providers, from hospitals, from consumer groups, our tribal communities, all of you who are participating. We appreciate in advance the data, the research, and the proposals and policy suggestions you're going to be giving us as we put together California's proposal for this important program. We do need to think outside the box. So we know that the Medicaid cuts that were made in H.R. 1 are huge. And frankly, the combination of funding cuts combined with more uninsured people is going to have significant impact. Unfortunately, the funding that we hope to receive in the Rural Health Transformation Program can't make up for that significant loss of federal funds. So it's going to be incumbent on all of us to work together to look for new ways of doing things to support healthcare in rural areas. And we look forward to your innovative ideas and suggestions. So again, we're committed to taking your best data, research, and policy proposals. And the team will be talking about several ways that we will seek this input from you, including a survey. We encourage you to consider, as you respond to the survey, existing resources, right? So the state is investing a lot right now in behavioral health through the Behavioral Health Transformation, the Behavioral Health Services Act, and the like. There may be other areas where there are fewer resources because, again, we're going to have to make hard decisions in areas to focus. We want to acknowledge today that we only have the information that was in the federal bill in H.R. 1 and that CMS has shared with us thus far, which is somewhat limited. So we will go over with you what we've learned thus far from CMS in a number of webinars that we've participated in over the last 2 weeks. So I'm going to move on to HCAI program areas just to let you know a little bit about who HCAI is if you don't know us and why we think we're well suited to put together California's proposal for the governor's office for this Rural Health Transformation Program. So these are the 5 areas in which HCAI works. On the facility side, we are the building department for hospitals and skilled nursing facilities. So we've worked with hospitals. We've seen some of the challenges with some of the rural hospitals. We also have a small and rural hospital relief program, specifically working with small and rural hospitals to comply with seismic safety standards. So that's important experience that we have. On the financing side, we provide loan insurance to nonprofit healthcare facilities. Our finance team at HCAI also stood up the Distressed Hospital Loan Program and provided grants to 16 of the most financially distressed hospitals in California. And so we bring that experience, having unfortunately a close view of some of the financial distress that some hospitals are facing. On the workforce side, we have decades of experience in working to develop and diversify California's healthcare workforce. We know that, as we'll talk about in a minute, that is one of the program areas highlighted for the Rural Health Transformation Program. So we bring that experience. And as you'll be hearing, we do house California State Office of Rural Health. So we have a lot of experience in interacting with and supporting rural healthcare providers. On the data side, we collect a lot of different healthcare data, from patient data to facility data, claims data, and so we will definitely be putting our data analysis skills to work here in informing the state's proposal. Again, we'll be showing you some data today, and we'll be leveraging other HCAI data and appreciate in advance other data sets that you want to send to us. And then last, affordability. HCAI houses California's Office of Healthcare Affordability, California's CalRx program, focused on prescription drug affordability, and the hospital fair billing program. And so again, we have experience knowing some of the affordability challenges that are unique to rural communities. HCAI now also houses the data exchange framework, an interoperability system by which health plans, healthcare providers, hospitals, and increasingly social services providers are exchanging data. And we think this is a critical component in providing efficient and effective care to all Californians. So we bring that experience as well. And then we will also have already been and will continue to collaborate closely with our sibling departments, including the Department of Healthcare Services, as well as our California Health and Human Services Agency and Governor Newsom's office, as we develop this Rural Health Transformation Program proposal. And then the last slide that I'll cover with you all shows HCAI's vision and mission. Our vision is a healthier California where all receive equitable, affordable, and quality health care. And it is that vision that will inspire our work on the Rural Health Transformation Program, which will be really key to achieving our vision. So all of HCAI's program areas are focused on this vision and mission that we'll again bring to the Rural Health Transformation Program. And with that, I'm pleased to turn it over to Hovik Khosrovian, HCAI Senior Policy Advisor, who will talk some about our workforce work and some of the data that we've pulled thus far. Thank you.
Thank you, Elizabeth. And yeah, I'll echo what Elizabeth said. It's amazing to see the turnout for this webinar. We're really excited. And we could clearly see that, there's so many people that are passionate about rural health and want to help support this program. So really I want to extend my appreciation to everybody on this call today, and then for everyone's future efforts in supporting us and helping and us supporting you. So with that, I wanted to kind of introduce a couple of areas here. As mentioned, HCAI is point for this proposal, the development of the Rural Health Transformation Program proposal. Within that, our workforce office is taking one of the key points of contact to really help develop it. So I wanted to give some background on the HCAI's health workforce. Some of what we do, our approach and strategy, and go into some data a little bit about how we see the structure of rural health right now as far as the facilities go, and then some key takeaways. So overall, with health workforce, we have a key goal within HCAI of really addressing the need of all health workforce within all parts of California. As you can see through our key goals, there are three main goals that we really focus on. It's to serve medically underserved areas, which includes a majority of rural communities. To serve Medi-Cal members, which spans across the state, as well as ensuring that the workforce that we're helping support and create and expand meets and responds and reflects the needs of California's population. So communities providers are reflective of the communities they serve. Communities that have unique needs and approaches really have the providers they need to really help address their workforce supply, as well as support them in improving outcomes. So within that area, we generally categorize it to four different kind of key financial supports that we do in workforce. We support the pipeline, which is key to, again, making sure we have enough individuals interested in health workforce, building that up, whether it's high school or even earlier, all the way through community college or through certificate programs after even high school or earlier. So we build on that with workforce pipeline. Then we go into educational capacity, which many of you might be familiar with. Some of this might be new to some folks here because I know we have quite a good widespread involvement from different communities. So educational capacity for us means generally supporting the increase of capacity to train and educate future health workers. So it's a real key if you want to address workforce. Third is ensuring that individuals pursuing health careers have the support they need to make sure that they're able to afford school, they're able to afford the training, they're able to have those support services around them to be able to basically say, anyone, doesn't matter where you're from, where you grew up, you have the opportunity to go into the health workforce and find a profession that really is rewarding for you. And lastly is with providers addressing retention, supporting providers. So we support organizations in using what financial abilities we have through our grants and programs such as loan repayment and scholarship to ensure organizations can offer these benefits to their employees to help with maldistribution of workforce, to help with the recruitment of new workers, and keeping the existing workers, because we know how valuable that is. Particularly when we look at rural areas, we know it's a real struggle a lot of times to recruit and retain your workforce. So we're really focused on that as well within workforce. And as you can see, our 4 kind of key areas that cover a lot of what we do. Behavioral health, which Elizabeth mentioned earlier, is quite a big component of what we do. We also have programs in nursing and recently midwifery, primary care, and oral health. So you can kind of see the combination here of what we do really impacts all of California, and really excited to have these opportunities to really expand what we do in rural health with this program. Next slide. So I wanted to kind of lay out the landscape of what we see in rural California as far as populations, individuals living there, and various kind of the facility information. So as mentioned, HCAI has a vast amount of information and data on the workforce and on the facilities and organizations in general that support the health system in California, particularly in rural areas. We have that as well. I also want to preface this data, because as we mentioned earlier, we're still waiting for more information from the Notice of Funding Opportunity from CMS on how rural is defined. I'm sure there's probably many opinions among all of us. We know, let alone federally, there's 4 definitions of rural. HR 1 has its unique definition. So when we kind of put this together, we wanted to get started at least what we understand as rural based on the U.S. Census definition. Starting at that point, hoping we believe really shows the rurality of California and shows a better picture. But obviously these might change as we get more information from CMS on how they define rural, hoping that they'll also accept some of our kind of interpretation of rural as well. Given that, I wanted to highlight some of the things here. So as you can see in the map itself, it kind of dispels a lot of probably national assumptions about California that we're not rural at all. As you can see on the map, outside of about 5 different spots, most of California is rural in general. You can see 95% of all of California is in a rural census block. Census block is the smallest component that the U.S. Census uses for data collection. So I wanted to kind of preface that as well. We have about 2.3 million people living in rural census blocks. So it's a significant amount. I believe that's probably about more than about 15 to 20 other states total. So it's a pretty significant population living in rural areas. So it's really like telling that story to dispel those notions about California as mainly, large urban centers where it's not accurate at all. Again, 57 of California's 58 counties have at least some rural population. So that's significant as well. And that's really telling that big story of like, it's clear and obvious that we are a rural state, and we have quite a significant amount of support needed in those communities. Also some kind of like data as far as the number of facilities itself. Again, prefacing that we're still, as things change, these numbers might change. The one number we know as a fact, because rural health clinics have to go through CMS approval, we know there's 279 rural health clinics. Those change year to year depending on the new clinics and some clinics that might close down, but that's kind of what we know as the baseline. We also have some estimates on federally qualified health centers. This is probably where our definition is probably specific to these census blocks, and things might change. So we estimate about 151 actual sites, not necessarily the organizations, but sites themselves, satellite sites. Sometimes the actual organization is centered in a rural community. And then we're estimating about 76 rural hospitals, and that includes our critical access hospitals, small rural hospitals, hospitals that are considered rural that might not necessarily be under the definition of small. So that's where we collect that information. And lastly, our office does the assessments for health professional shortage areas. Those are the federal designations for levels of shortages for providers. In this case, looking at primary care health professional shortage areas, we estimated about almost 50% of all rural communities are in a shortage area, which is pretty significant. And it's much higher than the percentage if you look at urban communities. So that's kind of where we want to start with the data and tell that story. And as things change, once we get more information from CMS, adjust it, but also try to focus on how we could strengthen that story and how we can support showing the significant volume of individuals living in rural communities and the facilities and structure that are in place that need our support through this plan. Next slide. So this is an additional slide following up from the previous data. Just really kind of wanted to put this out to everyone to view. Again, this is the preface of that these numbers may change, but wanted to kind of show how that's structured with the maps itself. So on the left side, we'll have the rural hospitals, again, those 76. This is based, and we have rural population densities. So the darker the color, that's more where the rural population is kind of centered. So you can see here how the state has a widespread. The map is pretty widespread number of facilities everywhere, but again, doesn't necessarily mean that that's enough facilities for the population. It just means what we currently have. And this is where we want to really dig into the data. Everyone that's on this webinar that can support us through that. If you have additional data to provide us as we send out the survey and ask questions and strengthen that application, really looking to what are these rural hospitals facing? What are the conditions they face? What are the situations? What support do they need? And then on the right-hand side, we have the kind of combination of rural health clinics and FQHCs. Understanding there may be additional clinics. These are the ones that we know as far as the data-wise that we have the cleanest data on because they're federal designations. They're available pretty widespread. But wanted to show that as well. You kind of see the spread of how those clinics are as well. As we got to get into the proposal and collect more information, we'll start kind of analyzing that and seeing where those facilities are, the kind of services they're providing, what more is needed to support them, and how that delivery system can be impacted through additional support through this plan. So that's really key here, and wanted to show this map to kind of have almost like a baseline of where we are with facilities, and knowing that there's much more than just facilities. We also have a workforce component that we're going to build out, and that's going through some of our supply and demand modeling, some of our data through our licensure data that we collect now. So there's more to come with data. This is just a quick snapshot to kind of lay out where we believe we are right now on the facility side. Next slide. So some of the challenges, we know that there's many challenges. It's hard to probably narrow it down to the list. This is just a snapshot of what we kind of have been seeing and hearing and reading through research and data. We know nationally many rural communities face the same issues. There are some instances in California where we have much more unique situations because of the size of our state, because of our geography, and then the populations that we serve. So we know in rural hospitals, rural hospital closures with labor and delivery wards are significant. We want to be able to support that. So we're hoping to really understand more about what we can do in that aspect, because we do believe, knowing that there's not as much information yet available from CMS, that one component that we have seen mentioned from CMS and the materials that they put out at the federal level is that they are really looking at maternity care as one issue that hopefully can be solved with this program. Additionally, we see things like health IT infrastructure. We know that's quite a significant burden on many facilities in rural communities, surely because of the size and the funding availability and not being at a large enough organization to really support the IT infrastructure that you might need. And we also look at workforce shortages. So that's something that we explained earlier. It's something that we're more familiar with. We work on a workforce in general, clinical and non-clinical. We also want to understand what these facilities are facing on a non-clinical, like management, administrative level that needs support, because we understand just bringing in more clinicians isn't always the answer. You also need the support at the administrative and management level to support the facility itself and the infrastructure. And as we kind of go through the list, we'll look at, there's always issues with rural communities and the workforce for the housing, and getting folks to come out to those communities and live there, knowing some areas are very rural. We know there's a lot of uncertainty at the federal level based on recent events, pending legislation and rules that might come out from the federal government. That uncertainty really makes things difficult for the providers themselves and for the organizations, because there's not a lot of consistency, and it's hard to have your organization have a path forward when there's a lot of changes at the federal level that impact your honestly your bottom line. And then we look at transportation. Rural population we know is aging. There's a much higher increase. There's an increased need for chronic disease management in rural communities, and of course there's always access to specialty care. That's a challenge as well. So these are just a snapshot of things we're looking at. We're really looking, when we send out the survey and have follow-up information and collection, to really understand what else is there and what more can we deeply go into with some of these challenges to understand them, and to see how the planning of the Rural Health Transformation Program can help solve some of these issues. Next slide. So also I'll also introduce one of the points for our office working on this with HCAI. Within our office is the State Office of Rural Health. It's a federally funded program. It's a state-federal partnership through HRSA, Health Resources and Services Administration, and cities. Right. Yeah, and I'm going to hand it off to Tiffany now. So I apologize, we went a little over. So I'm going to hand it off to Tiffany Frazier now to go over the State Office of Rural Health.
Okay, thank you, Hovik. Yeah, Hovik got a little bit happy. He loves. Oh, sorry. Okay. So thank you guys. My name is Tiffany Frazier, and I am the program coordinator for the State Office of Rural Health. I'm going to take a moment to tell you a little bit about SOAR in case you're new to us, and then I'm going to jump into our guest of honor, which is the Rural Health Transformation Program. So SOAR, or the State Office of Rural Health, is a federal, as Hovik said, is a federal state partnership through the Health Resources and Services Administration and the Federal Office of Rural Health Policy. We effectively serve as the state right arm of FORP. We are expected to collect and disseminate information, coordinate healthcare activities, and provide technical assistance to all rural health constituents. SOAR is actually new to HCAI after being at DHCS for many years. SOAR transitioned to HCAI in 2022 as part of a package that included our small hospital improvement program, Medicare Rural Hospital Flexibility Program, and the J1 Visa program. All of these programs, including our workforce and HCAI programs, fit together to make us uniquely situated to take on the Rural Health Transformation Program. So the Rural Health Transformation Program, or RHTP, is a strategic effort to improve healthcare in rural areas where access, workforce, and infrastructure gaps create unique challenges. The RHTP is an investment of $50 billion from the federal government over 5 years to transform rural healthcare access. This program was designed to improve access to community healthcare providers and to improve health outcomes. Next slide, please. So the intent of the funding is to provide support for hospitals, clinics, FQHCs, and other healthcare providers to make the investments necessary to better meet the needs of rural communities and become more sustainable over the long term. So while we do understand that hospitals form the backbone of rural health, this program will support and reinforce all of the providers that make rural great. This fund was not created to support Medicare and Medicaid, but as a resource to transform how rural healthcare is delivered and paid for. So we do understand that those cuts are going to make a huge difference to all of the providers in rural healthcare. We're not supplementing that, but we do hope to make a difference in how we are delivering healthcare. Next slide, please. So let's talk about the funding, the fun part. So The entire investment is $50 billion. 25 million will be distributed equally according to an approved application, and then an additional 25 billion as determined by factors identified by CMS. As far as state distribution, the baseline is 100 million. Obviously, we have to get our plan approved first. And then the additional funding may be available based on application scores. CMS will be including in the application a roadmap for us to use our data to provide a case for California to receive that additional funding. And that's what we will be doing, obviously, with your help. CMS must have all applications approved by December 31st. And again, while we haven't received all of the information yet, we're assuming that sometime mid-September, the NOFO is going to be released, and then the application will be due in November, but they have to be approved by CMS by December 31st. And then once we do receive the funding, we have 2 years to spend each year's funding allotment. Next slide, please. So now I'm going to go over some of the goals that each state has to address in their proposals. Improving access to care, improving outcomes, promoting consumer-facing technology-driven solutions, strengthening local partnerships and networks, expanding the rural health workforce, advancing data and technological innovation, and supporting system sustainability. Also, we can identify specific causes for rural health closures. So all of these goals are used so that we can use the following activities to advance those causes. So we're gonna, as of this time, we don't have an idea of how many of these activities we are going to put into our plan. This will all depend on the things that you guys ask for us to focus on and the things that we decide are important for us to focus on, but we have to choose at least 3. So promoting evidence-based interventions to improve prevention chronic disease management, TA, software, hardware for significant tech advances to improve efficiency, cybersecurity, and patient outcomes, payment to providers, promoting technology-driven solutions for prevention and management, training and TA for developing and adopting technological-enabled solutions that improve care delivery in hospitals, and recruiting and retaining clinical staff to rural areas with the 5-year service obligation, supporting access to OUD and SED treatment, and projects that support value-based care, and any additional uses designed to promote sustainable access to high-quality rural healthcare services, and those will be determined by CMS. So next slide, please. So all of those things will go into all of the stakeholder engagement that we are expecting to hold over the next month and a half. Today is our kickoff webinar. Tomorrow, you will receive a survey from HCAI. That survey is going to ask questions regarding all of the activities and some of the goals that you guys want us to concentrate on. The survey will be open for a week, so we do apologize for the short time frame, but we're all on a short time frame with the plan that CMS and the bill has set out for us. So we do appreciate you guys taking the time to fill out the survey, and we are asking that one person per organization complete the survey. It's about 25 questions. It has some demographic questions in there. It also, just for some housekeeping issues, it cannot be saved. So you have to complete it in one sitting, but you can leave it open and it'll hold your answers. But if you close out of it, you'll have to start over. So we do have some open-ended questions at the end that you may want to get started on those before you start the survey. When we send the survey out tomorrow, we will send out a PDF of the survey so that you guys can look over the questions before you actually open the survey. So mid-September, we'll receive the release from CMS, and we'll have a lot more information once we receive the guidance from CMS. During the time, September 15th through the 26th, we plan to hold additional phone calls and additional engagement with priority stakeholders. Not necessarily webinars or anything like that, where we will hold phone calls or meetings with key stakeholders. Also during that time, we will begin drafting the priorities. The week of September 29th, we feel that we should have a close draft of the priorities when we will start having feedback listening sessions from the public. So we'll have another rollout just kind of like this that's open to everyone to come, and we'll have multiple of them. So if you can't do one, you can do a separate one, but you won't need to do multiple. You can just do one. And those we will do for that entire week from September 29th through October 3rd. And obviously, some of these dates may change due to our priorities and needs, but we will try to keep to the schedule as much as we can. We will also make sure that you guys are informed as much as we can about what we are doing, as long as you are. Can you go to the next slide, please? As long as you are keeping up with us. So this we have our contact information for you. The most important thing I want to pull out is signing up for our rural health mailing list. Make sure when you go in there, you select rural health. That is how you can ensure that you will receive all communications from SOAR. Also, our website, that will be, we will have our survey there. We will have all the information that you guys need to learn more about the program there. And then our email address, if you guys have any additional questions that you didn't feel that got answered today, feel free to reach out to us at calsor@hci.ca.gov, and we will respond to you there. Also, I just want to reiterate, as Elizabeth said, we do encourage your feedback and your input. So if you have any data or research that you feel will help us with the plan, please feel free to put that either in the survey or send that to us in our email. And now I'm handing it back to Chris, who is going to start the Q&A.
All right. We have one quick correction from Hovik, and then we will get on with the Q&A.
Yeah, I just sorry, there's a typo in the budget slide. Just want to make sure everyone that saw it. It's 25 billion is that baseline amount split amongst the 50 states. So just want to make sure everyone saw that. What that means is if your application is approved from CMS, the states will divide equally. It would equal 100 million per year. That's the baseline. So it's 500 million for the total. So I just want to make that quick correction there in case everyone saw that 25 million, it's actually 25 billion. And that second part, the additional 25 billion, that's where it's a little more based on CMS's priorities and which applications they want to support with additional funding. Thank you.
All right. Thank you so much, Hovik. Thank you, Tiffany. Thank you, Elizabeth. As you can see, our team has been diligently working to implement this program, and we are excited to share it with you today. We will now move into the Q&A session. To ask a question, click the chat button in the menu bar, and you can type your question. The chat option is now enabled. During the Q&A, we will be focusing on questions related to our plan for stakeholder engagement for the Rural Health Transformation Program. While we can discuss the general structure of the plan as outlined by CMS, we do not have specific details yet regarding the program's content or funding priorities. Today, we're happy to answer questions about the general structure of the RHT plan, our approach to stakeholder engagement, and the survey we'll be sending out tomorrow. For questions about specific program details or funding priorities, please email our team at calsorh, CALSORH, at hci.ca.gov, and we'll help you guide you as best as we can. As we go into Q&A here today, we're going to do our best to get to as many questions as possible in the time that we have together. And excuse me. Let's go ahead and jump to our first question here. All right. First question is, how do you define key stakeholder?
So right now, those are trade association groups that we commonly work with, but really anyone that has ideas or if you get a group together, anyone that has ideas about kind of what we want to invest in the plan. So right now we have a list of current partners that we have worked with, including our government partners, our county partners, trade associations, and groups like that. But we're always open to additional ideas.
All right, thank you, Tiffany. For the survey, please define organization, facility, or owner.
Yeah, thank you for that question, Shelley. So I know you're part of a hospital system, and so we don't mean to be unduly limiting in that way. So if you have individual hospitals that want to submit their own, that's fine. We just want to ask folks to coordinate within their own organization. So either facility or owner is fine for that.
All right. Question about, can you please send us the PowerPoint presentation? We will have the presentation and the recording on our website within 5 business days, and we will also be sending out the email with the survey tomorrow. We will continue to keep everybody in the know with our emails and all of that. Again, please sign up for that rural health listserv on our website if you haven't yet, to get all of our emails. Next question, will nurse assistant training, home health aide training, and mental health aide training qualify for the workforce training?
Yeah, I can take that. So there are no parameters for which types of workforce qualify for the program. As of now, CMS hasn't defined it. The only definition they've added was in HR1 for what provider meant, and the provider, by their definition, meant anybody accepting Medicaid or Medicare. It was a pretty broad definition. So we're hoping when the notice of funding opportunity comes out from CMS, there'll be more information in there. But as of now, from what we understand, on the workforce end, it's any and all health workforce. It's not limited to any particular areas.
All right, thank you, Hovik. Laura asks, will the PDF version of the survey be the whole survey or just the open-ended questions? I would appreciate the PDF version of the whole survey.
Yeah, it will be the whole survey.
It will be the whole survey. Yes. Thank you. How are you determining who to send the survey to for each organization?
I can take that. So we have multiple lists. So we have our pretty extensive HCAI stakeholder list that will get the survey. We'll also have the individuals that registered for this webinar. They'll also get a direct email with the survey as well. It'll also be posted on our website. So it's open to anyone and everyone that would like to fill it out. Again, reminding everyone if one organization has multiple individuals, if you can condense it so we can quickly digest and read the data and the material. But it will be, again, stakeholder list, this list, as well as on our website. And then any and everyone, it's also shareable. So those that get the link can share it and forward it on to others as well. So we want to make sure everyone and anyone that is within California who either works in rural health, touches rural health some way or other, is able to give us responses. Because that's really what's going to drive our development of the plan.
All right, thank you, Hovik. Natalie asks, is the data that you all shared in the beginning all publicly available?
Yes. Yeah. So, the data on the facilities is available in the open data portal for California Health and Human Services. And we'll also, as we build out our rural health transformation page and we post more materials there, we'll include some links to that data as well, especially once we have a clear understanding of what CMS is defining as rural. We'll include that as well. So we'll have a whole process of directing everyone that is looking for data, as well as anyone that wants to share data to be able to contact us.
All right, thank you. Next question, are you looking for feedback from emergency healthcare providers, ambulance, paramedicine?
Yes.
Yeah, we really want to hear from anyone who thinks that they have a perspective to share about how we can improve the rural health arena. Absolutely.
And that is a great answer for the next question. What kind of stakeholders should fill out the survey?
Mm-hmm.
I can take that. So and I think we mentioned we want to really ensure everyone that's connected, involved in rural health is able to fill it out. So whether that's an organization, a facility, associations that represent multiple types of organizations, and even community members and providers as well, because we really want to get their perspective, because we want to ensure that they get what they need, with the individuals that live in rural communities are able to get what they need as far as services. And then the individuals actually providing those care directly are able to tell us through that survey what they see are issues and what's needed there as well. All of that is really important for us. So we want to make sure, again, everyone that is connected at all to rural health or has suggestions or ideas on rural health, so that we definitely don't want to limit it to specific groups or organizations.
All right. There's a question for a repeat of the email address. Alma, if you could put the CalSOAR email address in the comments. And looks like you already did that. Thank you so much. We'll put that in there a couple times for people to be able to see as they go through the comments in the chat. Next question, what is your definition of rural? Is it based on population numbers, HPSAs, MUAs, etc.? Yeah,
so that's the $1 million question. So that's the one where we're hoping the Notice of Funding Opportunity from CMS gives a little more insight. We could share, there was a few webinars that CMS did for the states. And in those, that question was asked as well, and they were deferred to when the Notice of Funding comes out. We know from the bill itself, there's some definitions of rural. It's a little more limiting than what we hope. So we're hoping that the Notice of Funding Opportunity gives more flexibility to the states to define that. As of now, it's based on the general definition of areas outside of a metropolitan statistical area, which is very vague and very limiting on what actually rural is and how rural health is delivered. So that's the definition of the bill right now. There's some flexibility there with the different it's called the Goldsmith, not to get into the weeds, but it's called the Goldsmith method. So there's a little bit there, but again, we're waiting for the Notice of Funding Opportunity to really understand the actual definition, so that we can align all our data with that definition.
All right. Olivia asks, is the funding only for hospitals, or can CBOs utilize as well?
Yeah, I can take that. So the funding is open to anyone that's within the rural health system. So it's not necessarily only hospitals. Clinics are included, provider groups, anyone and everyone that potentially could support the main activities and goals that were outlined earlier by Tiffany in the presentation. Those are who can really participate and be supported through this program. So it's not necessarily just for one type of facility or setting. It's much more expansive because it is about transformation. It's about actually changing how the system delivers care to ensure this long-term sustainability. So that could be additional folks, including CBOs, would be able to participate.
All right, thank you. Kelly asks, will a draft application be available to comment on for the listening sessions?
Yeah, so right now, we haven't decided the format for the listening sessions, but you will have something to comment on for those listening sessions. That's why we are holding them kind of at the back, where we'll have more information on what we will be actually moving forward to CMS.
All right, thank you, Tiffany. Since the survey cannot be saved, please post a PDF or Word doc of all the survey questions. We will be doing that definitely in the email with the survey going out. There will be a PDF attached for you to go through in advance. Thank you for that. Laura says, can we share the survey through all your rural health clinics? It's been answered, but we're going to encourage you again. Please share this out with all of your network and anybody you think should have this. If they're not aware of it, we would love for you to amplify this and get it out to as many relevant people as possible. All right, Jenna asks, are there any plans to create a metric for determining specialist and subspecialist physician shortages by region for Medi-Cal patients specifically?
Yeah, thanks for that question. So we're definitely talking to DHCS. Also, we'll be reaching out to DMHC. So the focus here is long-term sustainability and improving patient access and improving patient outcomes. So we will be looking at a range of access metrics. I think we'll be relying on both DHCS and DMHC for data they have about network adequacy and about timely access. So I don't know that we will necessarily create a metric, but we will be looking to them and talking about data. And if there is data or a particular metric that you think is critical, we look forward to hearing from you. Please do include that in your survey response.
All right, thank you for that, Elizabeth. Let's see, Haley asks, how can stakeholders sign up for participation in a listening session?
And I'll take this one, Helvig. So just make sure that you sign up for our mailing list. That's the list that we will use to reach out to for participation in all listening sessions and any and all engagement that we have in the future.
And that ties into the next question from Martha. Will we have an opportunity to review the state RHCP before it is sent to the feds?
You guys want to take that? I don't know. Go ahead.
Yeah, we can't commit to sending out a draft application beforehand, but we do. We are committed to very meaningful engagement with folks. So we'll, again, be putting out proposed priority areas, getting your feedback, and that'll be very helpful to us.
And we do plan to be very transparent in our listening sessions and with all engagement so that you guys, it may not be the exact proposal, but you guys will know what we're working on.
All right, thank you. Let's see, next question. Jim asks, the states can use for paying for healthcare services. Would this include expenses related to EHR implementation costs to support those services?
Yeah, good question, Jim. So the law does call out different technology approaches, and we do have some questions in the survey asking to get your input about whether implementation of EHRs or electronic health records and data sharing, whether those are priority areas.
All right. Thank you, Elizabeth. John asks, for the CMS optional grants, are these based upon the state's plan filed for the first tranche of funding or separate applications?
So according to the webinars that we attended, it looks like it's just going to be one application, and they're adding some questions in for that additional funding.
Yeah, so again, as Tiffany went over, half of the money, $25 billion, goes equally to every state with an approved application. And then the other half, the other $25 billion, is based on the scores, but it's just one application.
All right, thank you. Martha asks, does the state plan require approval of the legislature and the governor before submission to the federal government?
No, it does not. It requires a support letter from the governor's office, and we'll be coordinating closely within the administration.
All right. We have not a question, but a comment. Please consider additional incentives for the hiring of providers in rural areas. It's very challenging to recruit individuals to serve desert rural communities. Definitely a wonderful comment, and please include that on your survey as we send that out. Clara asks, for the workforce training component, are there specific topics that they are looking for?
Yeah, there isn't anything specific. The language itself in HR 1 on the workforce component talks about recruitment and retention of providers with including a 5-year obligation for those that get that support. So generally within the federal government, if you're familiar, recruitment retention means financial support, whether through scholarships, loan payments, stipends. We're waiting for the notice of funding opportunity to get more details on that to see how flexible that is. Because generally when you see a requirement of a 5-year obligation, that's what usually it means. But again, there's a lot of flexibility, it seems like in this program. So we're hoping once the notice of funding comes out, there's some more details on what that actually entails.
All right. I do notice a number of questions in here that are dealing with specific ideas that we would love to hear on your survey. Because we're almost out of time today, we're going to ask that these specific ideas do be put in your survey results, and we will definitely take those into consideration. It's why we're sending that out. We want to hear from you. Next question: when sending these presentation slides, may we get the get up the financial updates showing the edits mentioned?
Yeah.
Yes. Thank you. Let's see, does HCAI, I think we've already mentioned the rural definition. John asks, what is the role of the counties in this process?
I can touch on that. Yeah. So we're hoping that the counties give us their input through the survey, and as well as follow up to us through our email address, because we really, one of the things we want to do stress is we want to ensure the counties' voices are heard here, to ensure, because they are the ones that are working directly with ensuring services are available to their constituents and their population. So we want to make sure the counties are involved and give us feedback. All counties, because just like I mentioned earlier, all but one county really have all rural communities. So we are hoping for that. We've reached out to the county health officers, health associations, and we also are trying to we'll also reach out to all the county offices for health. So we are hoping that everyone is able to submit information through that survey and follow up as needed. So the role of the county, I would say, is pretty significant in this process.
All right, thank you, Hovig. Let's see, Travis asks, if a hospital has RHCs, do they just do one survey or a survey for the hospital and one for each clinic?
Yeah, again, Travis, we'll give you some flexibility on that. So we encourage you to coordinate, and we'll have a lot of data to distill. But if it's important for one of your outpatient clinics to submit separately, that's fine.
All right. Thank you, Elizabeth. Mark asks, will you be taking submissions from medical equipment manufacturers who offer products that improve quality of care, protect HCWs from airborne exposure, save time, and offers technological advances?
Yeah, so I see this question. I see an earlier one about asking about capital improvements. So capital improvements and some of the equipment manufacturer issues have not been called out in the statute. We're still going to wait to see what the federal guidance is. But again, the focus here is really improving the long-term sustainability of healthcare infrastructure in rural areas and improving patient access and patient outcomes. So in any case, we'll have to make the case that this is fundamentally doing that. And then I see Catherine Phillips has a question about, will we be partnering with Oregon and Washington? Hopefully folks saw Governor Newsom's announcement that unfortunately the state is having to step up where the CDC has not risen. So we are doing some collaboration with Oregon, Washington, and now Hawaii around access to immunizations. Do we see them as competitors for federal money? I don't know that there's a need to collaborate specifically with other states. Our State Office of Rural Health is certainly in close contact with other state offices of rural health. And so I don't know that we will be collaborating on California's proposal necessarily. Anything you want to add on that?
No, but yeah, just like you said, we do talk to our other states in our region regularly. We go to conferences and RHTP is on everybody's mind right now. So we're all talking amongst each other, and if we can find ways that work for our state, it's all the better for us.
All right, we're almost out of time today, and I'm scrolling through the questions to make sure that we get those that we can answer today answered. I noticed a number of questions about what will we do with funding when it gets here. I think that's a question that we're not going to have an answer for yet. I also, again, noticed a lot of questions that look like more along the lines of the stuff that we want to hear from you in the survey. One question was regarding signing up for the the Rural Health Listserv, and I just want to go through that real quick. If you go and to the mailing list link, you scroll down to the healthcare workforce section. In that, you'll see a checkbox that says Rural Health, and you're going to click on that box, and that will get you on our Rural Health mailing list, and you will receive all of the updates from SOAR. Let's see here. I think we've got time for probably one more question, and then we're going to go to our closing statements here. And we'll make sure that we get one that we can answer here today. Let's see here. All right.
So just to jump in
Do you
real
see
quick,
one?
I see a question about will the state issue a NOFO once the funds are received? So we haven't made those decisions quite yet. Right now, we are concentrated on the plan, getting the plan out. We do have to put in a work plan as part of the application on how we will be doing that. And those decisions will come a little bit later.
All right. Well, thank you so much for all of your thoughtful questions and participation. If we didn't get to your questions today, or you think of one later, please email us at calsor@hci.ca.gov. And again, we're going to have that survey coming out tomorrow. That's our primary way of getting all of your input for this plan. Now I'm going to hand it back to Elizabeth for some closing thoughts.
Thanks very much, Chris. And so again, want to thank the several hundred of you who participated in this. This is both an important opportunity to support and transform rural healthcare in California, and also can't be all things to all people. So we look forward to your innovative ideas. Please know that we will take them all very seriously and try to wade through what we know will be a lot of asks for a limited number of dollars. And we're committed to doing the best job that we can for all Californians in fulfilling the intent of this to transform and strengthen rural healthcare. So again, thank you for participating. Thank you in advance for your thoughtful suggestions. We know that we'll get from you, and expect the survey tomorrow, and let us know if there are questions. Thank you so much for participating.
All right. Well, we appreciate you joining with us. Thank you, Elizabeth. Thank you, Hovik. And thank you, Tiffany, for guiding us through this conversation today. This program is an important part of HCAI's health workforce development efforts, and we're grateful for your engagement with us today. We would love for you to visit our website to explore the full range of HCAI resources. You can find that on the slide here. We also would love for you to follow and engage with us on our social media platforms. We have lots of options available for you. And you can contact us at this phone number and this email address on this next slide, and our team will be happy to assist you. That does conclude today's webinar. Thank you again for attending, and we hope you have a wonderful day.